Hey there, Impact Shapers! Ever launch something you're super excited about, only to hear crickets? Well, let me tell you a bit of an embarrassing story that actually taught me a valuable lesson along my public health journey, and why I'm now currently obsessed with design thinking. Picture this. Nearly a decade ago, younger Veronica, full of passion, dreams, and a healthy dose of overconfidence, decided to launch a podcast and an online program for women's health and empowerment. I built this whole curriculum based on, wait for it, pure intuition and vibes. No research, no evidence base, no community input, just what I felt was right and observations. Now, did I pour my heart into it? Absolutely. Did I completely believe in it? You bet. Did it serve my intended audience? That's where things get interesting. The program didn't grow far, and at the time it felt like a failure. But looking back now, it actually taught me one of the most valuable lessons of my career. It taught me the fundamental difference between creating for people versus creating with people. Fast forward to today, and I'm approaching public health curated differently. Using design thinking principles, we're co-creating with our community, testing assumptions, and building based on real needs. So what exactly is design thinking, and why does it matter for public health? Think of it as a framework that puts human needs at the center of everything we create. It has 5 key stages. Empathize, which is actually understanding our community's experiences. Define, getting crystal clear on the real problem. Ideate, generating creative solutions. Prototype, testing ideas quickly and cheaply. And test, getting feedback and iterating. Let me show you how this would play out in real life. Remember my women's health program? Here's how it would look differently using design thinking. Instead of building a curriculum based on assumptions, I would have started by having coffee with potential participants, shadowing women navigating health services, creating journey maps of their experiences, and testing small pieces of content before building a whole program. But here's where it gets exciting for public health. Design thinking isn't just about creating programs. It's actually about transforming how we solve problems. Let's take something we deal with regularly, such as low turnout in health education sessions. The traditional approach might be to blame lack of community engagement, maybe add more incentives, or create more flyers, perhaps. But through a design thinking lens, we might shadow community members for a day to understand their schedules, map out all the barriers for attendance, potentially prototype different meeting formats, or test various locations and times. We'd even co-create content with community members. Ready to try this yourself? Here is a simple way to start. Pick one program or a service you're working on right now. Tomorrow, spend just 30 minutes talking to someone who uses or should use your service, then drawing out your journey map and identify one assumption you can test. You know what's beautiful about design thinking in public health? It automatically builds equity into our work. Because when we truly understand and co-create with our communities, we're not just building more effective programs, we're actually transforming how power works in public health. This week, I challenge you to identify one assumption you've made about your community or program. share it in the comments below using hashtag PHC Design Thinking. Let's learn together. Remember, Impact Shapers, sometimes our failures are just prototypes for our future success. Keep experimenting, keep learning, and most importantly, keep creating with, not for, your community. Until next time, this is your Public Health Bestie, Veronica, reminding you that your creativity is exactly what public health needs. See you next time.